You can't sleep. Your heart is racing. You feel anxious and overwhelmed. You blame it on stress, from work, from life. But what if that stress isn't in your head, but in your medicine cabinet? A patient, let's call her Jenna, came to my counter last week with this exact problem. She was terrified. She told me, "I'm so stressed, I think I'm having panic attacks. I can't sleep." But after I asked my one crucial question, "What else are you taking?" we found the real culprit. It wasn't a new anxiety disorder. It was her over-the-counter cold medicine containing pseudoephedrine. Today, I'm revealing 9 common medications, from OTC pills to prescriptions, that can mimic the exact symptoms of anxiety and insomnia. Stick with me, and by the end, you'll be able to spot if your medications are the hidden cause of your anxiety or insomnia, just like I did for Jenna. I'm PillMuse, a pharmacist bringing you real advice from the pharmacy counter. Let's get started. Alright, now let's dive into which medications can actually mimic stress in our bodies. I'm going to walk you through 9 different medications, and to make this easier to follow, I've organized them into 4 categories. The first category is sympathetic stimulants. These drugs directly trigger your body's fight or flight response, which is why they produce symptoms that look almost identical to stress. Number 1, decongestants, pseudoephedrine, phenylephrine. Remember Jenna's case? These are the culprits. You'll find these ingredients in cold and allergy medications, and here's the thing, most of them are over-the-counter, so you don't need a prescription. That's exactly why they're so easy to overlook. Pseudoephedrine and phenylephrine work by constricting blood vessels in your nasal passages to relieve congestion. But here's the problem, this effect doesn't stay limited to your nose. It stimulates your entire sympathetic nervous system. That's why you can get anxiety, insomnia, and heart palpitations. Pseudoephedrine is especially tricky because it can cross the blood-brain barrier and directly affect your central nervous system. Studies have shown that some patients experience symptoms so severe they're similar to panic attacks after taking this medication. Number 2, short-acting beta-2 agonists, albuterol. If you have asthma, you probably carry a rescue inhaler, and most of these contain albuterol, also called salbutamol in some countries. This medication is designed to target beta-2 receptors in your airways to open them up, but the problem is it can also stimulate beta-1 receptors in your heart. The result? You might experience nervousness, tremors, and heart palpitations. The good news is that since this is an inhaler rather than an oral pill, it has less systemic effect, so these side effects are relatively uncommon. However, if you're using too much or using it too frequently throughout the day, the concentration in your body builds up and these symptoms become more likely. If you're reaching for your inhaler multiple times a day, that's actually a sign that your asthma isn't well controlled, and you should definitely talk to your doctor about it. Number 3, ADHD medications, methylphenidate, amphetamines. ADHD medications work by increasing dopamine and norepinephrine levels in the brain to improve focus and concentration. But these same neurotransmitters also increase your state of arousal, which is why anxiety, insomnia, and heart palpitations can occur as side effects. In fact, if you look at the official FDA label, you'll see anxiety, insomnia, and tachycardia listed as common side effects. If you experience these symptoms, you should work with your doctor to adjust the dose or change the timing of when you take it. And I can't stress this enough, never stop or adjust the dose on your own. The second category includes medications that directly affect your hormonal balance. Number 4, oral corticosteroids, prednisone. Prednisone is a powerful anti-inflammatory used for autoimmune conditions and severe allergic reactions. The thing is, this drug has a chemical structure similar to cortisol, which is your body's stress hormone. So it basically acts like cortisol in your system. Especially at high doses or with long-term use, you can experience mood changes, agitation, anxiety, and even severe insomnia. Some patients experience excessive energy and a state of euphoria while on steroids. This is sometimes called steroid psychosis, and in severe cases, it can even cause hallucinations or delusions. If you're taking steroids and notice these symptoms, never stop abruptly on your own. That can actually be more dangerous. Always consult your doctor first. Number 5. Thyroid hormone, levothyroxine. Levothyroxine is used to treat hypothyroidism, and the issue here is when the dose is too high. An excessive dose can unintentionally create a state of iatrogenic hyperthyroidism. When that happens, you get all the symptoms of an overactive thyroid: anxiety, irritability, insomnia, and heart palpitations. That's why regular blood tests are so important when you're on thyroid medication to monitor your hormone levels. This is especially crucial when you're first starting the medication or adjusting the dose. If symptoms appear, it might be a sign that your dose needs to be adjusted. The third category includes medications with surprising effects, either doing the complete opposite of what we expect or causing side effects people don't see coming. Number 6. First-generation antihistamines, diphenhydramine, such as Benadryl. Diphenhydramine is known for causing drowsiness, right? In fact, many people use it as a sleep aid. But surprisingly, in some people, especially children and elderly patients, it can cause the complete opposite reaction called paradoxical excitation. Instead of feeling calm, they experience restlessness, anxiety, and agitation. This paradoxical reaction is uncommon, but it's been documented more frequently in children and elderly patients. And here's something really important to watch out for: if you're taking a combination cold medicine, it might contain both a decongestant and an antihistamine. If both drugs produce stimulant effects in you, you're getting a double hit. Just like in Jenna's case. Number 7. Caffeine. Caffeine is the most widely used psychoactive substance in the world. In fact, the DSM-5, that's the Diagnostic and Statistical Manual of Mental Disorders, officially lists caffeine-induced anxiety disorder. Consuming more than 250 milligrams a day can lead to caffeine intoxication, with symptoms including restlessness, nervousness, insomnia, and rapid heartbeat. The problem is caffeine isn't just in coffee or energy drinks. Some pain relievers, especially migraine medications, contain significant amounts of caffeine too. For example, Excedrin contains 65 milligrams of caffeine per tablet. If you're drinking 2 to 3 cups of coffee a day and then taking caffeine-containing pain medication on top of that, you're consuming way more caffeine than you might realize. The final category is about medications where it's not the drug itself that's the problem, but rather when you take it or when you stop it. Number 8. SSRIs, for example, fluoxetine. SSRIs, selective serotonin reuptake inhibitors, are excellent medications for treating anxiety and depression in the long run. But during the early phase of treatment, especially in the first 2 weeks, anxiety, agitation, and insomnia can actually get temporarily worse. Patients who don't know this often think, "This medication isn't working for me," and stop taking it on their own. But this might just be a temporary phenomenon that happens as the medication starts to work. In fact, the official FDA warning specifically mentions that anxiety and agitation can increase during the early phase of SSRI treatment. That's why doctors start with a low dose and slowly increase it. If you've just started an antidepressant and experience these symptoms, try to give it at least 4 to 6 weeks. Of course, if the symptoms are too severe or unbearable, you should contact your doctor right away. Number 9. Beta blockers, for example, Metoprolol. Beta blockers are used for high blood pressure and heart conditions, and the problem here is abrupt discontinuation. When you take this medication long-term, your body adapts through something called upregulation of beta receptors. Basically, the number of receptors increases. So what happens if you suddenly stop the medication? All those extra receptors suddenly get stimulated, causing what we call a rebound phenomenon. Your heart races, you feel palpitations, anxiety hits, and your blood pressure shoots up. What's even more serious is that for people with underlying heart conditions, this can trigger angina or even a heart attack. So when you need to stop a beta blocker, you must do it gradually under your doctor's supervision, slowly tapering the dose down. Never, ever stop this medication on your own. This is genuinely dangerous. So there you have it, 9 medications divided into 4 categories. We covered sympathetic stimulants, hormonal regulators, drugs with paradoxical effects, and medications where timing is crucial. What do all these drugs have in common? They're all legal, medically necessary medications. The problem is that they can unintentionally cause stress or anxiety symptoms, and patients or even some healthcare providers might not be aware of this connection. Next, let's look at what can happen if these symptoms are ignored. Now for the really important part. You might be thinking, it's just feeling anxious and not sleeping well, what's the big deal? But ignoring these symptoms can lead to 2 major problems. Problem 1, the vicious cycle begins. Let's revisit Jenna's story. Jenna developed insomnia because of the pseudoephedrine in her cold medicine. But she didn't know it was from the medication. So what did she do? She took a sleep aid to solve the insomnia. Now imagine if Jenna chose an antihistamine like Diphenhydramine as her sleep aid, and she happened to be someone who has paradoxical reactions to it. What would happen? She'd be stimulated by the decongestant, and then the antihistamine would also have a stimulating effect, creating a double hit that makes everything worse. This is the vicious cycle. You don't know the cause, so you just try to treat the symptoms. More medications get added, and the symptoms actually get worse. Even your doctor might not realize it's a drug side effect and diagnose you with anxiety disorder or insomnia, potentially prescribing psychiatric medications on top of everything else. Studies show that about 5 to 10% of hospital admissions visits are due to medication side effects. And many of these are initially misdiagnosed as other conditions. Problem 2, missing a real medical condition. The second problem is even more serious. The symptoms you're experiencing might not just be drug side effects, they could be signals of a genuine new health problem. Let me give you an example. Say you're experiencing heart palpitations. You assume it's just a medication side effect and ignore it, but it turns out you actually have an arrhythmia. Or you might have hyperthyroidism that's being mistaken for levothyroxine overdose. Heart-related symptoms are especially concerning. Palpitations, chest pain, shortness of breath, these are easy to dismiss as just stress or anxiety, but they could actually be early warning signs of serious heart disease. That's why when new symptoms appear, especially after starting a new medication or changing a dose, you must consult your healthcare provider. Don't just brush it off as probably just stress. Alright, let's wrap this up. I'm going to summarize what we've learned today into 3 action steps. Number 1, check. When new symptoms appear, especially anxiety, insomnia, or heart palpitations, pause before blaming it on stress and think. Did I recently start a new medication? Did any of my doses change? Then carefully review your medication list. Include everything: prescription drugs, over-the-counter medications, supplements, and even the coffee or energy drinks you're consuming. Read the medication labels and package inserts. Your symptoms might be listed in the side effects section. You can also search online for the medication name along with side effects. Number 2, consult. If you find a suspicious medication, never, ever stop it or adjust the dose on your own. This is especially true for prescription medications. Remember? Suddenly stopping antidepressants like SSRIs or heart medications like beta blockers can be really dangerous. Instead, talk to your doctor or pharmacist. Here's a tip from me as a pharmacist: bring a complete list of all your medications when you visit the pharmacy. Taking photos of them on your smartphone works great too. And make notes about when the symptoms started and whether they appeared after taking a particular medication. This information is incredibly helpful in identifying the cause. Number 3, communicate. Here's the most important message I want to leave you with. The reason I made this video isn't to encourage you to self-diagnose. It's actually the opposite. What I want is for you to communicate more effectively with your healthcare providers. To become an informed patient. Next time you're at the doctor's office, try asking this. Doctor, could the anxiety or insomnia I'm experiencing be related to any of the medications I'm taking? That one question is enough. Your doctor or pharmacist will review your medication list and, if needed, find alternative medications or adjust your doses. And this is really crucial, make sure to mention over-the-counter medications and supplements too. Many people don't mention them, thinking, oh, it's just a vitamin or I got this without a prescription, but those are exactly the things that might be causing the problem. Today, we went on a journey to find the hidden culprit. We learned that symptoms you thought were stress or anxiety might actually be caused by medications sitting in your medicine cabinet, and we covered how to identify and address this. Remember, medications are tools for your health. But all medications have side effects, and sometimes they can affect our bodies in unexpected ways. If you use the knowledge you gained today to actively communicate with your healthcare providers, you can avoid unnecessary suffering and receive better treatment. I'm your pharmacist, PillMuse. I'll continue bringing you useful health information based on real patient cases I encounter every day at the pharmacy counter. If you found this video helpful, please subscribe and turn on notifications. And if you have similar experiences or questions, leave them in the comments. Your story might be a huge help to someone else. See you in the next video. Stay safe, stay informed. And if you'd like to see an alternate version of today's video, featuring different cuts of the visuals used, check out my Patreon. It's all there for curious minds, just follow the link in the pinned comment.